resting place for you and a loved one? At Caballero Rivero, we're offering a special sale on our beautiful lawn crypts at Southern Memorial. For a limited time, you can secure a lawn crypt for two, including the grave space, vault, taxes, and fees for all just under $14,000. This offer provides a complete package to ensure your peace of mind and the perfect final resting place for those you cherish most. But hurry, this exclusive offer is only available until August 31st. Don't wait to take this important decision. Contact us today to schedule a visit and see for yourself why so many families trust Caballero Rivera with their most precious memories. Call 786-253-0211, 786-253-0211. Southern Memorial, a place of serenity, beauty, and enduring care. Bonsoir tout le monde, bonsoir, bon après-midi. You're listening to Chat with Kat. I am your host, Kathleen Barreau. For Chat with Kat, we have a very, very, very special show. I said very 3 times, so that means it's an extremely special show. We have 2 amazing guests that are coming on. Before we start the show, I just want to give a special shout out to Bethel Evangelical Baptist Church off of 441 and 172nd Street. I had the pleasure of doing Pastor Clement Cherry's mother's homegoing celebration, and I just want to give a special shout out to Pastor Kenny and his family, Pastor Alan Boucard and his wife, and just everyone that has been very supportive to what it is that I do. So now, without further ado, we're going to get on with the show. We have two very, very special guests. They are daughters of the community. They have been doing a very, very good work in our community. And guess what, guys? They are doctors. I have not one doctor, but I have 2 doctors. These 2 doctors have 20 years of combined experience in nephrology and family medicine. They both have their doctorals at the University of Alabama in Tuscaloosa, and they both have their masters in nursing in their respective schools in Florida. So without further ado, I want to introduce Dr. Adeline Dormius and Dr. Charlotte Jarrett. Welcome to the show, ladies.
How are you?
Good.
Hello.
Welcome to Chat with Kat. So tell us, guys, tell us who you are so the listeners will know who you are.
Well,
Whoever wants to go first.
I guess I'll go first.
Okay.
So you did a great job. That's who I am right there. So my name is Charlotte Jarrett. Mm-hmm. I am a nurse practitioner. Currently, I practice family medicine for home-based patients. So it's a lot of hospice, palliative care, ending of life type situations.
Oh, wow. Up my alley.
Yes, ma'am. Yes, ma'am. So it is a very humbling position, and it really helps to keep life in focus. So on the days when, the gram can be quite distracting, I go to work and I'm like, it's not that important. It's really not. So that's what I'm doing now. And then before that, I was also working in primary care, but in a clinic-based setting. Then I did a little ER as well. And before that, I was a registered nurse in the ER. So,
all right.
Yes.
Okay. And or Dr. Adeline?
Yes, my name is Adeline Dormius. So I've been a nurse practitioner for over 10 years. Currently, right now, I'm in nephrology. So I deal with a lot of dialysis patients. It is humbling, definitely more humbling, learning about the struggles that my patient faces as they go through dialysis. Previous to that, I was in primary care, so that was rewarding too as well. So providing care and education to our patients is huge for me.
All right. So before we actually get into the topic, I don't know too many people who know that study. I only learned it because I served as a juror for a malpractice suit. Can you tell the guests what exactly is the study of nephrology? What is that?
So nephrology is the study of kidney and kidney diseases. So it deals with polycystic kidney disease. It deals with patients that are going to be on dialysis. So we provide care for those patients.
All right. So you guys heard it. It's the study of the kidneys. Why did I bring these wonderful guests on the show? Gagne un topic qui est très, très, très important qui est le diabète. diabetes. I might have butchered the word by diabetes. We know at least somebody in our family who gained diabetes, dialysis. Unfortunately, I had a friend of mine who died of kidney failure. You know who that person is. I'm not going to mention her on air. And she was a very, very young person. She had, other underlying issues, but, her kidneys, she had to go through, what do you call it? Transplant. She actually had her kidneys donated to her. And this is something that's so important in our communities. I don't know if you ladies have noticed. We have, dialysis centers mushrooming all over the place. We are people that we love our tafia. I'm guilty. I like a little cocktail here and there. We like our gato, we like our desserts, we like sugar, and that sugar doesn't like us. So we're devoting this show to talk about diabetes, and these two young ladies, they see it all the time. One of them actually works for a dialysis center, so she sees it 5 days a week, and then she also is part of the health ministry at Bethel Evangelical Baptist Church. That's where I know Adeline from. I used to go there, and she's part of the health ministry, where many of the members there, they struggle with that. So that's why we're going to be talking about diabetes today, because we have a mom, a dad, a grandma, an auntie, even some young people that are pre-diabetic that shouldn't be pre-diabetic. So we're going to get onto the show, and I'm going to ask one of you ladies to please briefly explain what diabetes is and how it affects the body. Anyone can take the topic.
Okay, well, diabetes is a chronic disease. So either your body's not producing enough, which is type 1, or your body is not utilizing what it produced, which is type 2. Okay, so that's basically what it's a chronic disease. It gets worse over time. You have complications from it. Type 2 is one that we can prevent or delay. And that's what we talk to our patients a lot about, making sure you exercise, taking care of yourself, diet, which is a huge problem in Caribbean community, because our diet is rich in carbs and sugar.
Very rich in carbs.
We love it. Of course, it tastes good.
It
So
does.
It's hard for us not to stop eating it or decrease eating it.
Like rice and potatoes.
Definitely rice.
And how does diabetes affect the body? I guess with the sugar and carbs, do you know the molecular part of that, or is that something I should probably go?
No, well, it affects it because the amount of sugar is increased in your body. So it causes damage to your nerves. So patients will have nerve issues. They'll have heart issues, kidney issues. It damages your kidneys. Okay, so that's the cause of causing it. So most of my patients who are on dialysis, the number one cause of being on dialysis is diabetes.
It's diabetes, okay.
Unfortunately.
No, definitely. And just to add a piece to that, in regards to the basics of diabetes when it comes to obesity, which is a epidemic.
Huge epidemic.
Here in the United States and in our respective countries. Though I have a French name, my background is Jamaican.
That's our island brothers and sisters.
So we're a little bit away, but it's the same thing, and we're seeing even in the countries themselves that there's not just processed foods. There's a new term from the World Health Organization, ultra high processed foods. Like that's how bad it is, that they had to come up with a new category of how processed it is. So like, for instance, in the Jamaican culture, we'll do like a cornmeal pudding, right? Or a cornmeal porridge, and you have that for breakfast.
And that's labui for us, or mai moulin for us guys.
So that's already something that's very carb laden. You have the sweet milk, the condensed milk, you have all of that. What they're doing now, what they've been doing, which has attributed to the diabetes and the obesity issues going on, is that now they have an instant cornmeal. So if the cornmeal wasn't bad enough, we're gonna take it and put some stuff that we can't pronounce, right? And put it in a cardboard container, and you just add water and put it in a microwave, a little radiation, and 2 minutes later, you've got some lovely cornmeal. So the foods that we're ingesting into our body definitely attribute to the weight. And what some don't, and I think most don't understand, and I think now people are starting to see how big of a deal obesity is. Like, obesity is up there with smoking at this point when it comes to lifespan.
Smoking, lung cancer?
Oh, it's that bad.
Oh, wow.
It's that bad. Like, obesity, sedentary lifestyle is a big deal. It's not a little thing. I mean, literally, abdominal fat that we have, right, that sits on our stomach, on our organs, literally blocks the body's insulin from getting inside to do what it needs to do.
Correct.
It becomes a blocking organ. It starts to actually function in our body to block the insulin. So as Dr. Dormier said, when it comes to type 2, it's not that I don't produce insulin. It's I produce the insulin, but the insulin is here. Where it needs to get to is here. What's blocking it? For most of the people, it's the fat that is now decided to turn itself into a barrier. So now, yeah, my body makes some insulin, but I need to take it because that's why it's good to understand that, because then, though it's a scary thing to get, it also empowers our patients and our community to understand that, hey, that's something that we can change. That's not something we have to stay with forever. If we are that committed, we can change the weight. We can change our physical activity. And then guess what? Now that organ is smaller and smaller. Now that insulin can get over. Now we can take better care. So that's one of the main ways that diabetes can be managed with diet and exercise.
Wowzers. Man, that was loaded. And we just started the show. That's all right. That's all right. So, ladies, how common is diabetes in the U.S. and globally?
The numbers. It's about 38 million people with diabetes currently in 2024. The totality is 38 million. And about like 8.7 are they have diabetes, but they don't know it. So the numbers are staggering. They're huge. It's huge.
Yes, and that's in the United States.
In the United States.
And what about globally? Would you have a figure for globally?
Globally, it's 500 million.
That's 500 million people that are that are diabetic.
I know.
Damn.
So it's an epidemic.
It's a huge epidemic. Do you ladies, have you ladies seen any recent trends
In what?
within the I guess the field of diabetes?
CGM.
What is CGM?
Continuous glucose monitoring system that they use now. Instead of pricking yourself, you actually can insert it. It's a device, and it works with your smartphone. So if you're, for example, if you eat something, it can tell you.
You need to expound on it. 'Cause I've been seeing that a lot. I've been seeing that a lot with older adults, like maybe in their 50s.
Everyone now.
And but I always used to wonder, like, how is something inside of you work like that? So so I'm sorry to cut you off.
So basically, you attach it to you. So it tells you your reading. So Charlotte and I, Dr. Jared and I, actually tried it on. We went to a conference and we were like, we want to try it on so we can see what our patients go through.
Yes.
It was an experience because every and anything we ate, the blood sugar went up or it went down.
Oh, wow.
So it showed you the effects of food on your blood sugar. And I ate rice and boy, did it go up. You know?
So when you said it go up, like, how do you notice it on your smartphone? Did you know? Oh,
you notice it on your
okay.
smartphone. So the numbers it will trend. It'll show you a graph. It'll show you the numbers, and it will tell you it's high. Like it's high. So for me, I think it's good for patients to see it because as a medical provider, we keep telling you don't eat rice. It increases your blood sugar, but when you see it for yourself,
It's different.
It's different. It's impactful. It's like, oh, maybe I shouldn't eat the bowl of rice anymore. Maybe I should cut it to half or less.
There you go. And I think that's a very good point. And that's something that we actually addressed with one of the booths from the CDC, that when it comes to the foods from different cultures, especially when we're here in the States, that is our foundation to our culture. So if you're going to tell me I can't eat my rice and peas anymore, or I can't eat my curry shrimp or my curry chicken, or it's like you're trying to strip my culture. It's not just stripping the food,
Your
So
identity.
exactly. So when we went there, they would have different things about how to do portion control and different meal plans. None of the meals look like anything we eat. We're like, so where's the Caribbean version? She had a Nigerian version. She had a Hispanic, a Mexican version. I'm like, yeah, but what about us? Like, where is our version? And I've reached out to her in an attempt to actually start to do that, because she said that's something she wanted to work on with us. Because if you have a large population of persons that are living with diabetes are minorities, and then, especially here in South Florida, are of an outside background. So it's Haitian, Jamaican, whichever Caribbean island, throw a pin at it, they're here in South Florida. And we want to educate on, hey, this is what you should eat. But I'm going to tell you, just eat broccoli and quinoa. What Caribbean person knows what quinoa? They don't even know what that is. So the teaching how to do portion control with the foods we already know and love is very, very important. It's a lot about the portion and the timing. Because some of us, we're eating until 11, 12 o'clock and going to sleep. And it's like, hey, you can have your rice. Right. Let's cut the portion and maybe do it for lunch instead of doing it for dinner. I'm not taking away who you are. I'm just saying let's adjust it so that we can decrease that fat organ so the insulin can get to where it needs to go.
So what are early signs of diabetes that people should be aware of? Because you mentioned that there's some people that don't even know that they have it. So what are early signs that people could kind of watch for?
I would say excessive urination, peeing a lot.
Really?
Like, you have to be careful about that, yes. Thirst, when you're so thirsty, like you can't have enough water. Urinary tract infections. Women, ladies, yeast infections chronically. You're having those chronically, blurred vision. So that's a sign where, you know what, I don't know what's going on. So let me set an appointment with my provider and see what's going on so I can do some labs. You know?
Okay.
Yeah. And in addition, if you have a wound that won't heal.
Correct.
That's a huge part of it. Poor wound healing is the start of one of the things that quite a few patients are concerned with is, limb amputation. So if it gets that bad, that can happen. So if someone's like, hey, I've had this wound for a really long time, it's not getting better, I'm just gonna put some bush and some herb on it, like, no. You need to speak to someone and actually go and get the blood test. As I tell my patients, the numbers have no need to lie. They don't have a dog in the fight. The numbers are just numbers. So if your number is diagnosed as diabetes, that's what it is. You're a person with diabetes. That is not the totality of who you are. But if you ignore that, that can become a really big weight in life. So it's really important to look at those things and go and get checked and just do the little blood test, see what it is. And, be willing to take action. And sooner is better. Prevention is way better than cure.
Got you. So who is most at risk for developing diabetes?
As we spoke on earlier, those individuals that struggle with obesity is definitely going to be a huge risk factor for diabetes. Our minority populations, a lot of the time because of our diet and what we eat, at times that will be a huge risk factor for diabetes. And if there's a family, we have to understand our family history. And when we understand the history and we know, hey, mom had sugar and dad had sugar and I have a sister that has sugar, then we need to be more vigilant on the preventative part. The Center for Disease Control has actually implemented since 1996. It's called a diabetic prevention program. And that there's government money put into that to prevent people from from progressing to diabetes. So when we say pre and then we say someone actually with diabetes, what we're going by is a number called an A1C, right? So an A1C, most patients have had it. When you do your regular, they did my blood at the office, that's one of the things that they normally would do. And A1C is a 3-month average of someone's sugar. So if you check your sugar right now and then you check it after you eat cake, it's going to change, right? But if you check it and then you take an average of it, that's what it does. So I teach the patients that if you think of the red blood cell like a bus and it drives around in your bloodstream for 3 months, all the sugar hops on. When we check it, we're getting the average of the sugar that's on it. So you can't cheat for that test. You can't say, oh, I'm going to eat really good for 3 days and I'm going to drink some parsley juice and it's going to be a good value. No. That blood sugar from when, I was there and I was, drinking all the cremas, that's going to show up from all the griot I was eating. It's going to show up. It's going to be there. It's not going to hide. So that number is the main diagnostic number. So for someone to have pre-diabetes, that number is 5.7 to 6.4. So that is pre-diabetic. For someone to say they are to be diagnosed as a person living with diabetes, that number is 6.5 and above. So if we go there, those are just hard, fast numbers. The numbers don't move, they don't change, they are what they are. So it's being able to move around those numbers and to understand what our numbers are, because that's going to empower our patients. And that's the really big thing that we are so passionate about, is educating our patients so that they can be empowered when they go to the office. It's not just, oh, the doctor or the nurse practitioner gave me this pill, it said this something, like they really understand what's going on with their health.
Got it. So what are psychological or emotional challenges people with diabetes face, and how can they be supported?
I think mainly it's the diagnosis. It's hard to hear that I have diabetes. Then most of my patients said, I'm going to have to stick myself. What? I can't stick myself. So it's depression. It's getting the diagnosis. Because diabetes is chronic, it takes a while to develop. So you think, okay, I've been doing this for so long. I don't have diabetes yet. I'm okay. But when you're finally hit with, you have diabetes, most of my patients said, so I'm dying. And it's hard to understand that you have diabetes, knowing that it can affect your eyesight, lose a limb, be on dialysis. It's not the most exciting thing to hear. So depression, anxiety, stress, it's hard.
Wow. Can you talk about what are some of the common complications associated with diabetes if it's not managed properly, please?
No worries. Definitely it's heart disease, cardiovascular disease, heart attacks, strokes, major complication, losing a limb, huge eyesight, being blind. It affects your nerves, not able to feel things. You can step on a nail and not feel it. So ending up in dialysis, like my patients, when they finally find out that they have to start dialysis, it's hard.
Wow.
It's challenging.
Wow. Is there any promising research or new developments happening in the care of diabetes?
Well, there have been so many new things that have come about, especially from the conference that we went to. They have, as Dr. Dormy spoke about, the continuous glucose monitors. There's on the market right now. There's a 7-day, there's a 14-day. Like, you can switch them around. They've now gotten to the point where they're developing an actual little filament that's implanted in for 6 months. So it's a microfilament. It just kind of sits around in the blood, and it's able to see what you're doing for 6 months. So same scanner type situations. They still, it connects to the smartphone. So I know some people are like, I would not do that, but but for some people that can be very convenient. So if it's not for that individual, that's okay, but there's so many more choices now. And especially for persons with diabetes type 2, there are now pumps that have been approved by the FDA that were only for type 1 diabetics, and that literally just happened like last month. That's very, very fresh. Before, to try to get an insulin pump for a person with type 2 diabetes was like pulling teeth. Like, you had to go to the endocrinologist and they had to appeal and do all these referrals, and it was very challenging. But if you have someone who they have to take 3 basal insulins and then they have to do 2 insulins on top of that, and then that they can stick themselves 5 to 6 times a day. Right. And that's just to go ahead and give themselves the insulin. That's not even monitoring their sugar. So the combination of the CGM with actually being able to have an insulin pump, is a wonderful new relationship that has come about, and it's an awesome opportunity for patients that have type 2 diabetes to have to stick themselves less. I don't say never stick themselves, because there's always a caveat to everything, but definitely it's way more convenient for the patients.
All right. What kind of support systems or resources are available for those to help those who are living with diabetes to maintain their health? Are there any resources or support systems that you've seen in your experience in the day-to-day? Mm-hmm.
Yeah, there is. There's group support for diabetes. I know with my dialysis patients, we do have group support. As Dr. Jarrett mentioned, the DPP program that they have, the government had money they put in to support patients and teach them about lifestyle to prevent diabetes. So there's so many, my churches have so many programs, walk programs, diet programs, nutrition program on how to prepare meals, what meals to prepare, different ways to cook. I might not necessarily use the white rice. I might decide brown rice. I don't know what quinoa is, but I can learn about it, So there's things that we can do in the community that are currently in the community that people can use. Walk clubs, just going walking in the afternoon. Walking is, people underrate walking. It's exercise. It's work. Just walking, doing that walk for 30 minutes, 5 days a week, it builds up. It adds up to you losing the fat around your belly. Just doing that. I think there's so many support systems and family and friends.
And that leads me to my next question. How can friends and family best support someone who is living with diabetes? I mean, it's one thing to go to a support group. It's one thing to go to a government-backed program, but this is someone that you're living with. So as a family member, as my spouse, my mother, my grandmother, my brother, my sister, how can I support you? Or my best friend, my bestie, how can I support you?
I would definitely say the first thing is to educate ourselves. I find in our cultural traditions, a lot of things are spoken, right? So stories are passed down by speech and by stories. However, sometimes misinformation is also passed down that way as well. And they're like, oh yeah, if you drink this, it'll take care of it. So you don't have to take that pill, or you don't have to check your sugar, or you can just do this. So as a family member, to educate ourselves so that when we are there supporting our family and our friend and our loved ones, we're doing that with good quality evidence, and to also make sure that we support them in making good decisions. Healthier eating, getting in those 150 minutes a week of exercise, and just really being that support for them.
And my final question, ladies, anyone can take it. What message would you like to leave our listeners regarding diabetes awareness, prevention, and management?
I would say you are the captain of your health. You are the one in charge of your health. So it behooves you to be informed. Educate yourself. There's no reason we can't educate ourselves. Have a great support system. Walk. Watch what we eat. Go to your doctor's visit. Please do.
All right. So you were listening to Chat with Kat. I want to say a special thank you to Dr. Charlotte Jarrett, also Dr. Adeline Dormius, your doctors of nursing practitioners. I was about to say nephrology, but I was like, but we're so grateful that you were able to come on the show. Is there a way that anybody could reach you really quickly, like in 15 seconds, if they wanted to reach out to you guys for?
Oh, definitely in our IG. So you can see Dr. Charlotte Jarrett on her IG, and myself as well, Adeline Dormius.
And what are the handles really quickly?
It'll be Adeline Dormius.
Okay, and you, Dr. Jarrett?
Charj413.
Awesome. So you're listening to Chat with Kat. We look forward to hearing from you guys next week. We have another special guest that's coming, and we appreciate you. Have a good week, and God bless.